Hi, everyone, and welcome to the NCCDH webinar called An Introduction to Decent Work as a Social Determinant of Health. My name is Carolina Jimenez. I use she, they pronouns. I am a person of multiracial ancestry, and I came to these lands as a refugee from Colombia. I'm speaking to you from Musqueam, Squamish, and Tsleil-Waututh territory, also known as Vancouver, which is on occupied and unceded lands.
And hi, my name is Rebecca Sheff. I use she, her pronouns. I'm a white settler speaking to you from what is now Toronto, the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, and the Haudenosaunee and the Wendat people.
It's so great to see so many of you logging in today. Rebecca and I are both knowledge translation specialists at the National Collaborating Center for Determinants of Health, or NCCDH for short, and we'll be co-hosting today's webinar presentation. The NCCDH itself is located on Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people. This territory is covered by the Treaties of Peace and Friendship, which the Mi'kmaq and the Wolastoqet peoples first signed with the British Crown in 1725. Now, I'd like to emphasize that this treaty does not deal with the surrender of lands and resources, but does in fact recognize Mi'kmaq and Wolastoqet title and establish rules for ongoing relationship between nations. And disrupting settler colonialism, white supremacy, anti-Indigenous racism, and anti-Black racism is really important to our health equity work at NCCDH. To that end, Pema, one of our helpers today, is going to link a few resources in the chat. The first is a beautiful NCCDH facilitated webinar about prioritizing reconciliation. And the second is a great resource called Let's Talk Whiteness and Health Equity. In terms of today's focus, we'll be discussing the ways in which white supremacy and racism impact the health of workers and contribute to inequities in the labor market. The NCCDH supports the Canadian public health community to address the structural and social determinants of health and to advance health equity. We are one of 6 national collaborating centers for public health working across Canada. We're funded by the Public Health Agency of Canada, and we're hosted by St. Francis Xavier University. In today's session, we're going to be covering some basic concepts relating to employment conditions, working conditions, and health equity, as well as describing what the precarious employment context is like in Canada. We'll unpack what decent work means and discuss its relevance to public health action. The session includes your engagement today throughout Slido and a question and answer at the end. We're going to be wrapping up by 1 p.m. Eastern as well. A couple of housekeeping items. So as you'll notice, this webinar is recorded and it will be shared with registrants via email and posted on the NCCDH website. Today's presentation is in webinar format, so you'll see there is a chat box that we'll use to share resources and that you can also use to message panelists if you have any issues. There's also a question and answer box that you can use to submit any questions you might have for Rebecca and I throughout. And a special thanks to Nandini and Pema from the NCCDH who are supporting us in today's session. To get us started, I would love to learn who's in the room today. So let's do a couple of Slido questions. Pema will put the Slido link in the chat, or you can also scan the QR code on the screen with your phone. You can also go to slido.com and use the event code on the screen. I always love watching it happen in real time. So we see that we've got some folks from Ontario, British Columbia, Alberta, Nova Scotia, Saskatchewan, and Quebec. Oh, sorry, I keep accidentally slipping the slide, giving you a preview for the next question. So we've got 42 people so far from Ontario, 17 people from British Columbia, where I'm at, Nova Scotia. Scrolling down here, we've got folks from New Brunswick, Manitoba, Prince Edward Island, Yukon, Newfoundland and Labrador. That's great. Thank you so much for being here with us today. Wonderful. So I'm going to move it over now to the next question. Which best describes your role? Wow, so right off the bat, we've got some health promoters, public health nurse. I'm also a registered nurse, so it's nice to see some nurses in the room. We've got some policy analysts, advisors, students, community developers. You can scroll down the list a bit here. Researchers, ooh, nutritionists, dietitians. Got some knowledge translators on the call, epidemiologists, medical officers of health. That's awesome. I hope that there's something here today for each and every one of you. We've mostly have health promoters on the call. It's really great. There's a huge link between decent work and health promotion as well, so it's great to see that. Wonderful. So with that, I will pass it over to Rebecca to begin our presentation.
Wonderful. Thanks, Carolina, and hi, everyone. So I'm going to cover some core concepts that you'll find in our Decent Work issue brief. And we'll reference this resource throughout the presentation today and also be bringing in new research. When we developed this resource, we were aiming to provide an up-to-date synthesis of peer-reviewed and great literature about how work impacts health and health equity in Canada, and to begin scoping the avenues for public health to address work as a social determinant of health. And what we found is that work is a powerful condition of everyday life that can promote or harm the health of workers, their families, and communities. So that's what we're exploring today. All right, let's start with a word cloud so we can visualize the words you associate with this topic and kind of start to get a sense of some of the existing knowledge in this virtual room. So in one word, I'll get you to describe how work impacts health. So if you go to Slido again on your phone or computer, you should see this new question has popped up. And Pema will link again to the Slido in the chat box. Great. Okay, already seeing income, stress, salary, connection, meaning, resources, working poverty, living wage, security, fulfillment, pressure, conflict, community, toxic exposure, mental health. This is amazing. No sick leave. So we're seeing lots of knowledge here already about the ways that work can promote or harm work. That's amazing. I'm seeing people are typing. Wow, okay. And we're seeing stress and income really coming through. All right. I'm gonna wrap it up quickly. Oh, there we go, okay. Thank you so much for getting started. So I'm gonna introduce some concepts that will help us kind of frame that understanding of how work impacts health. Because when we look at the literature, we see there's really two foundational concepts there. So work actually sits at the nexus of two distinct but interrelated social determinants of health, and that's employment conditions and working conditions. So first, in working conditions, this refers to the exposures that workers face while on the job, such as physical, chemical, ergonomic, biological, psychosocial hazards. And so it's hazardous and unsafe working conditions that can result in avoidable injury, illness, and death for workers. And it's really when there isn't good policy, procedure, worker empowerment, and culture that we really see illness and injury So that's why we have occupational health and safety laws and procedures. And some of you on the line might have worked, might be occupational health folks, or might have worked closely with those colleagues during the pandemic because of the shared responsibility that public health had to protect against infectious disease in the workplace. So then we have the second key concept, which is often overlooked, and that's the employment conditions. So this refers to the conditions of a worker's contract. It's the nature of the employment relationship, hours, compensation, etc. So when we think about health outcomes, it's helpful to think about employment conditions on a continuum. So on one end, we have standard, secure, permanent employment conditions, which are associated with positive physical and mental health outcomes. And then on the other end, we have precarious employment conditions. And these are what are associated with negative health outcomes. Okay, so what do we mean by precarious employment conditions? This includes the following characteristics, and it can be a mix of these for different workers. So low wages, we have schedule uncertainty and income instability, job insecurity, involuntary part-time, casual, flexible, temporary, or gig employment, and then powerlessness, worker powerlessness. So this can be a lack of collective bargaining through unions, limited worker rights, and then powerlessness to exercise those rights and speak up when there's hazards. All right. And I'm going to take this moment to define employment standards laws, because these are a really important piece of what makes up workers' rights, in addition to occupational health and safety laws, human rights laws, accessibility laws, etc. So there are provincial, territorial, and federal laws that offer minimum protections for workers. So, for example, the Nova Scotia Labor Standards Codes, the Ontario Employment Standards Act, or for federally regulated workers, there's the Canada Labor Code. So in these legislation, this is where we find really important worker rights like the minimum wage, required breaks, paid sick days. So these laws play a big role in shaping employment conditions. And they are particularly important for non-unionized workers who don't have collective agreements. So when we have stronger employment standards, this can really create a solid floor of worker rights in your province, territory, country. Okay, so what does this all mean? How does this matter for population health? When we look at the health literature, we see that precarious employment can be as harmful as unemployment for health. So it's not enough to have a job. The quality of that job does matter. I'm going to walk through just a couple examples of the mechanisms through which precarious employment impacts health. So one of the big ones is low wage and minimum wage. Employment is the main source of income for most Canadians. So when we have minimum wages that aren't keeping pace with the cost of living, this can really contribute to poor health outcomes, food insecurity, income instability. But that can be compounded by schedule uncertainty and a lack of guaranteed hours. That can really mean that workers' paychecks can vary a lot week to week and month to month, and contribute to further income stability and poverty. Schedule uncertainty also impacts time with family, children, social connections. Another part of precarious employment is a lack of benefits. So throughout the pandemic, we've seen that the lack of paid sick days can really impact negatively workers' ability to stay home when they're sick, but also to go get vaccinated. And there's further literature about how a lack of paid sick days can make it harder for workers to go to other appointments, preventative cancer screening, etc. We also see a lack of medication, dental, eye benefits for precarious workers, and this can result in things like medication non-adherence. Okay, we're going to take a pause and get you to pull up Slido again on your phone or computer. And Pema will add the link again in the chat box. And I'd like you to see if you know or can guess the answer to this question. So fill in the blank. Workers who have inadequate employment standards, as well as occupational health and safety vulnerability, are at blank times greater risk of physical workplace injury. So 0, no difference, 1, 3, or 5. Great, I see 90 plus people are contributing. I love it. And in this study, so occupational employment standards included having regular payday, regular breaks, rights to paid sick day or vacation time, and paid wages. So really basic employment standards. Okay, get in your guesses. We're going to close this shortly. Thanks for everyone's. And the majority of you said 5 times greater risk, and you are right. So let's move to the next slide. And really what I wanted to emphasize with that slide is that there is a relationship between precarious employment conditions and hazardous working conditions and health. So we see this is one of those ways that that relationship happens. So inadequate employment standards can increase the risk of injury for workers. Occupational health and safety vulnerability can increase the risk of injury, but together, both inadequate employment standards and occupational health and safety vulnerability can actually have a super additive interactive effect and really increase the risk of injury. So we see 5 times greater risk compared to workers who do have adequate employment standards and occupational health and safety. So there's a real relationship there. I'm going to walk through an example to apply some of those concepts I just shared. So, well, I'll do that with the example of hotel housekeepers. So these are people who clean guest rooms and common areas in hotels. These jobs can look quite different across the country, but there are some working conditions and employment conditions I've pulled out that have been documented. So, for example, working conditions, hotel housekeepers can be exposed to ergonomic hazards through lifting beds and heavy equipment. This can lead to repetitive motion injuries. Housekeepers can also be exposed to chemical hazards through cleaning products that can lead to skin reactions and respiratory illness. And they can be exposed to a number of other hazards, including violence and harassment. We also need to look at their employment conditions. So in some cases, housekeepers actually have higher rates of unionization than other workers. So this constitutes a more secure employment condition and can contribute to the power they have to advocate for their rights and exercise those rights. But there's also parts of their employment conditions that can be quite precarious. So for example, housekeepers are much more likely to have low wages than the average worker, and also a lot of income insecurity and schedule uncertainty because of cost-saving measures by hotel employers who can really impact the cleaner's hours based on occupancy. So there are definitely employment and working conditions that raise concerns here. And we need to then ask, who are the workers who are exposed to these conditions? In Toronto, for example, the hotel housekeepers are disproportionately women, immigrants, and racialized workers. So this really raises some flags about health inequities. Okay. So that was the core concepts. Now I'll focus on why precarious employment is an urgent public health issue in Canada. And there's 3 points I want to emphasize here. So first, precarious employment conditions are prevalent, and in many cases, they're growing. Second, these conditions are intentional and modifiable. We can change them. And then third, these conditions disproportionately impact workers who face structural oppression, which leads to health inequities. I'm just checking in case there's any issues. Okay, good. So I'm going to go into a couple examples to support those 3 points and provide some stats and examples. So the first point that I said, that precarious employment conditions are pervasive in Canada. Only half of workers surveyed in 2019 in BC had full-time permanent jobs with benefits. The other half had various levels of insecurity, including contracts that were temporary, part-time, did not offer dependable hours, or lacked benefits. If we look across the country, we see that in every province, the rental wage, the wage required to afford average market rent, exceeds the provincial minimum wage in every province. So our minimum wages are really not keeping pace with the cost of living. Okay, our second point. So we need to ask, why do these harmful conditions exist? And it's not by accident, and it's not a natural thing that just happens. Precarious employment exists because of social norms, public policy, and corporate behavior that sees workers as commodities and allows for the exploitation of workers for profit. So we see that there's an inadequate public policies and worker protections in place to reduce and respond to precarious employment conditions. So inadequate minimum employment standards, like minimum wages that are too low. We see that certain workers are exempted from even those minimum standards. Immigration policy can further increase the precarity of migrant workers. And we see lack of enforcement of occupational health and safety laws or minimum employment standards. Next, we have corporate exploitation and disempowerment of workers. And then finally, harmful, dominant business and societal narratives. So one example of a harmful narrative about work is the idea that it really just should be up to workers, individual workers in precarious jobs, to just get better jobs, rather than questioning why in such a wealthy country we would have any job that would expose a worker to such harms. And rather than transformative narratives that say every job should be a healthy job, healthy and safe job. So this is all to say that these conditions are intentional, harmful, they're human-made, and that means they're modifiable, changeable, and that public health has a role to contribute to that change. All right, so the third point about why this is an urgent public health issue is that precarious employment contributes to health inequities. So we know that these health harming conditions exist, and we need to ask who experiences them most. And it's not equally distributed across our population. So workers who experience structural oppression are disproportionately exposed to precarious employment and hazardous working conditions. For example, in BC, racialized and Indigenous workers are much less likely than white workers to have secure jobs. Across the country, lesbian, gay, and bisexual workers are approximately 3 times more likely to be precariously employed compared to straight workers. And we also see across the country that migrant workers face increased precarity due to immigration policy, closed work permits that really put them at risk on the job, and make it really difficult to speak up about hazards because of fear of deportation or losing their jobs. So all of this results in health inequities. I'm going to give one final example about how precarious employment intersects with climate crisis, because it's so important to be thinking about how all these different social and structural determinants of health are very interrelated. So Pema shared the report published by the Worker Solidarity Network, which is a group of non-unionized precarious workers in BC who are advocating for their rights and striving for improved employment standards. And this recent report explores the profound health challenges that food service workers in BC faced during extreme weather events as a result of climate change. So flooding, wildfire, heat. And the report documents that there were pre-existing precarious employment conditions for food service workers in BC. And then the working and employment conditions really deteriorated and worsened as a result of these weather events. So workers experienced fainting on their shifts, heat stroke as a result of the heat wave. They often didn't have enforced breaks or ability to hydrate through their shifts, didn't have protective health and safety measures, and were unable to refuse unsafe work without fear of losing their jobs. And it really was the workers themselves who helped each other get through these events, these heat waves, flooding, wildfire, with really no support from managers, public health, employment laws. So there's really a glaring gap here for improved public policy and also public health action. And the report highlights, for example, the need for stronger worker protections like a maximum temperature policy. Yeah, so this is really a great example of a group of precarious workers who are really leading, taking a lead here in highlighting some of the health harms. Okay, so to sum it up, precarious employment conditions and hazardous working conditions are a pressing source of health inequity in Canada. Hopefully you have a clearer sense of the problem now, and I'll turn it over to Carolina to discuss the solution and how public health can contribute.
Thank you, Rebecca. That was really great. And so I'm going to be speaking to decent work. I think it was really interesting for me to see some of the answers in the word cloud, and one of the biggest answers was stress. But I have good news because work doesn't have to be bad. It can be good. And that's where decent work comes in. So if precarious employment conditions and hazardous working conditions are the problem, decent work is the solution. Decent work is a global goal, an agenda for change, and a movement in Canada to confront precarious employment and achieve dignified and healthy working and employment conditions for all workers. This term was originated by the International Labor Organization many decades ago. This organization is a specialized agency of the United Nations. Decent work is actually a part of Goal 8 in the United Nations 2030 Sustainable Development Goals, which Canada has committed to on a federal level. And it was also included in the World Health Organization's 2008 Landmark Commission report on the social determinants of health. So we can clearly see how some key global figures, as well as nationally, are positioning themselves in order to advance decent work as a goal and an agenda for change. So this gives us a really clear way to leverage the decent work movement in public health. Decent work contributes to positive health outcomes to workers, their families, and communities, because decent work includes secure, permanent jobs, adequate wages, hours, and benefits that keep up with costs of living. They have adequate minimum employment standards and rights for all workers without exceptions, strong occupational health and safety protections, and a strong worker voice and collective worker power, as well as enforcement mechanisms for these work-related policies and standards. So now that we've talked just a bit about how decent work relates to health, we're going to go back to Slido, and I'm curious to know how decent work or working conditions or employment conditions might intersect with your specific area of work. So Pema will put the link back in the chat. I believe this is an open word, open text question. So feel free to just pop it in there. I see that 14 participants are typing so far. So we have advocating for solutions to food insecurity. Yes, definitely. Some of those policy level solutions. Mental health. Yes, for sure. Advocacy for healthy public policies. Yes. Yep. Opportunities to grow, mental health promotion, building resiliency, spread of infectious disease. That's huge. Pay equity, decent work. Oh, you guys are going too fast. This is too good. Community economic development, support worker organizing. I love that. Policy change. Yes. Topic for research. Yes. And we'll definitely get into some of that later. All determinants of health. Yes. That's one of the things that we see is that decent work really intersects with all, like many of the determinants of health. So there's a key opportunity there. Pursuit of social justice, well-being, motivation to contribute to community. Yes, I love it. Health equity. Yes, health equity is definitely central to decent work. A large part of health promotion. I love it. Lots of food security coming through. Amazing. Childcare, fair wages. Yep. So many answers. I love it. Basic income, definitely. Yep. Poverty reduction, anti-racism. Yes, definitely. Rebecca talked a bit about who is disproportionately impacted. So in order to address anti-racism, we have to address anti-racism in the workplaces as well and in the labor market. Unionizing, yes, I love unionizing. Job security, I love it. Just for the sake of time, I'm going to move us along, but thank you so much for your awesome participation. And so Dr. Tam has actually discussed how decent work intersects with public health. And some of you mentioned this already in terms of infectious disease. And so during the COVID-19 pandemic, she said that improving workplace protections, increasing the number of quality jobs, ensuring equitable access to quality jobs, and addressing the impacts of precarious work could support greater health among Canadians and strengthen our collective response to future waves or pandemics. So there really is an important role for public health to promote decent work, not only because good jobs protect health, but it also allows communities to be more resilient. And as we learned from Rebecca, precarious employment and hazardous work are pressing sources of health inequity in Canada, and as such, are key areas for intentional, well-resourced public health action. So we've already gotten some really great examples. I think most of these really have been covered by the Slido we just did, but what are some examples of the intersections between decent work and public health? Well, we spoke about how it intersects with a lot of other determinants, including climate resilience, food security, income. All of those have already been mentioned by you folks, which is really great. Decent work also intersects with existing public health efforts around healthy public policy. So specifically thinking about employment standards legislation, labor standards, provincial as well as federally, occupational health and safety as well. It also intersects with health promotion and disease or injury prevention. For example, looking at workplaces as key sites for health promotion. For example, with vaccination clinics, we saw this quite a bit during COVID-19, that mobile vaccination clinics were getting dispersed to workplace sites for migrant workers, for example, as well as infectious disease prevention, such as COVID-19, flu, norovirus, you name it, as well as workplace injuries or even deaths. It also intersects with workplace inspections. And so workplace inspections really give us insights into the working conditions, often the hazardous working conditions, and that gives us an opportunity to be able to develop some plans with different employers and at different workplace sites. It also intersects with surveillance or population health assessment and research. For example, we can gather data on the health impacts of employment and working conditions and write summaries about this and reports about this. We can also conduct research to fill knowledge gaps about work and employment that might exist in the community. I know that gig work is actually a big one that some public health folks are really trying to grapple with and understand how it's showing up because it's such a new way of working. It also intersects with public health's role in advocacy to advance decent work agendas for social change as part of social justice, as well as engaging in intersectoral partnerships. So working with others in the decent work movement to bring about that decent work change. And so to that end of intersectoral partnerships, we know that there is a vibrant decent work movement across Canada. And this movement includes community researchers and worker-led groups such as unions, community organizers, and NGOs. And I want to draw your attention specifically to worker-led community organizing groups, whose membership consists of workers with lived expertise and lived experience of precarious employment and hazardous work. This includes groups like the Migrant Workers Alliance for Change, Justice for Workers, Gig Workers United, Worker Solidarity Network, which we already spoke about, as well as the Decent Work and Health Network. And these worker-led community organizing groups have developed evidence-informed decent work agendas, which include policy demands or policy solutions that are directly rooted in workers' lived experience. And so public health has an important role to support these decent work agendas and solutions, as well as to learn from and work with worker-led community organizing groups. And there are many benefits of partnering with worker-led groups. A few of them include advancing grassroots and solutions-based approaches that embed lived expertise to address health inequities in the workplaces specifically. It can help make our public health efforts more responsive to issues that are happening on the ground. This is particularly important in times of public health emergencies that require timely and nimble approaches to public and population health. It can help strengthen trust and social cohesion by being connected to broader movements and the communities we serve. And so next, I'd like to provide a bit of a case study, a case example, where public health in Ontario took action to promote decent work. The National Collaborating Centre for Determinants of Health, we've published a few equity in action stories about this case, and we'll link to those in the chat as we go along. And so the story begins in 2020. COVID-19 had begun, and the Employment Standards Act in Ontario did not include paid sick days. And this was an issue that was quite big across Canada. In fact, at the time, it was estimated that 58% of workers in Canada and over 70% of workers making less than $25,000 had no access to paid sick days. And this was a major public health concern because workplaces, especially precarious workplaces that we know disproportionately employ racialized workers, low-income workers, were hotspots for COVID-19 transmission. And Peel Public Health recognized this and became one of the first public health units in Ontario to actually assess and report workplace outbreaks by sector. This is going back to public health's role in data that we talked about a few slides ago. In 2021, Peel Public Health actually found that 1 in 4 COVID-19 cases identified through contact tracing were individuals who went to work with symptoms. And this data was incredibly valuable for the growing paid sick days movement. And not only did they assess and report on this decent work data, but they contextualized the data by meeting with community partners, engaging with them, and collecting the stories behind the numbers. Overall, their approach was rooted in values-driven approach to decent work that was rooted in values of humility and trust. And around the same time, the Decent Work and Health Network, which is a group of community organizers and health workers based in Ontario who had long been taking action on precarious employment and paid sick days, saw this moment in 2020 as a unique opportunity to co-lead an intersectoral strategy with various public health actors to action advocacy for paid sick days as a key health promoting measure. This intersectoral strategy led to the Association of Local Public Health Agencies in Ontario to publish a statement that endorsed paid sick days policy and called for action by the provincial government. You'll see it up on the slide. It also led to motions being brought to local boards of health in support of paid sick days, which included public health evidence as well as the lived experience of those in precarious employment. We saw medical officers of health and other public health leaders acting in support of paid sick days by speaking to the media, doing press conferences, writing op-eds, and presenting scientific briefs, such as the one by the COVID-19 Advisory Science Table in Ontario. And so this was really an important moment when public health championed decent work, as well as meaningfully engaged community partners. And as a testament to the strength of this intersectoral collaboration, the decent work movement won temporary paid sick days in Ontario and all over Canada. The ones in Ontario have since now, unfortunately, expired, but this advocacy really changed the narrative on decent work and paid sick days. It showed that better employment standards is possible during times of austerity. And this narrative change and advocacy snowballed to motivate workers and public health actors in other provinces and territories, and even nationally, to speak up in support of decent work. And as a result, we now have 5 permanent paid sick days legislated through employment standards in British Columbia. This happened in 2022. The Worker Solidarity Network led a major campaign in British Columbia with others to achieve this huge legislative win. And now we also have 10 legislated paid sick days through the Canada Labour Code for federally regulated workers. And I truly believe that if it wasn't for public health, as well as community organizers on the ground working together, we wouldn't have had these huge legislative wins. And there are actually many other examples of public health's leadership on the issue of decent work. The NCCDH alone has published several of these examples from across the country. I'll point you over to our resource library, and you can check them out by typing decent work or working conditions in the search bar of the resource library in the website, on the NCCDH website. And to further build on this great repository of work, the NCCDH will be publishing a decent work practice brief, which Rebecca and I are really excited about. We've been working really hard on it. And this builds on what we've discussed here in terms of what we found in the evidence review and the issue brief, to really focus more on how the Canadian public health community can promote decent work. And the practice brief will identify key public health roles, actions, and necessary approaches to the work. So, as a summary to today's conversation, we learned that employment conditions and working conditions are powerful social determinants of health. They are separate yet interrelated concepts that exist on a continuum. On one side of the continuum is precarious employment conditions and hazardous working conditions, which drive health inequities by disproportionately impacting workers who already face structural oppression. We learned that precarious employment in Canada is growing due to inadequate public policy, corporate exploitation of workers, and health-harming narratives. We also heard and learned that these narratives and that precarious employment are modifiable. And so on the other end of that continuum, is decent work. Decent work is a common goal, an agenda for change, a movement in Canada, and an avenue for urgent and well-resourced public health action. And so to that end, we already started to speak a bit about how decent work intersects with public health efforts, your efforts here today on the call. And we discussed a really exemplary case of public health championing decent work issues and partnering with worker-led groups, which led to some tangible and permanent legislative changes. Okay, so that brings us to our question and answer period. So I'll pass it over to Rebecca to see if we have any questions in the Q&A.
Thanks. And thank you for those of you who have been adding questions throughout. And I'd encourage anyone else who has questions to get them into that question and answer box, and we'll be able to answer them now. The first one from Laura. What is the top policy, program, initiative partners like NGOs are advocating for? Carolina, can I pass that over to you? You have a good sense of the decent work agenda.
Sure, yeah. So the decent work agenda, of course, isn't exactly the same province to province because, as we know, the employment standards change provincially as well as nationally. One example in Ontario, the Justice for Workers, as well as the Decent Work and Health Network, they have a decent work agenda that asks for a higher minimum wage. I believe it's a $20 minimum wage. Paid sick days, I believe it's something like 7 or 14 permanent paid sick days. And the way that the paid sick days are delivered is also important, and that they need to be accessible. So often we know that with paid sick days, people have to go get sick notes, but from a public health perspective, it doesn't make sense for sick people to go wait in congested doctors' offices, and sometimes that can be a barrier. They're also asking for equal pay for equal work. So in Ontario, for example, workers who are part-time in comparison to full-time, they actually have differences in wages. Other organizations, for example, like the Gig Workers United, who have developed a Gig Workers Bill of Rights, are doing some work around the practice of misclassification, whereby gig workers are being misclassified as independent contractors when they actually should be seen as employees of organizations like Uber. And as a result of that misclassification, they're actually exempt from the Employment Standards Act, which is a major problem because, corporate entities can get away with even going below the floor standards. Other groups, for example, like the Migrant Workers Alliance for Change, as part of their decent work agenda, is status for all and regularization for all workers, because as Rebecca mentioned, having that closed work permit and no access to permanent residency pathways is something that's really difficult for a lot of migrant workers, and that they are tied to their employer. And so due to fear of deportation, or other forms of retaliation, they're not speaking up about the conditions. And we really saw this case crack open in the COVID-19 pandemic, when public health inspectors really had to go into workplaces to do different COVID-19 efforts. So that's sort of an at a glance view. I know that, for example, the Worker Solidarity Network also has some additional climate-related decent work asks, including like additional breaks, as well as including climate paid leave, and so on and so forth. So I definitely recommend checking some of those worker-led organizing groups out.
Perfect. Okay. Okay, so what else do we have here? I see a really important comment from Edith saying medication non-adherence seems a harsh term when people cannot afford to buy it. It implies they don't want to take the meds, which in reality they can't. So thank you so much, Edith. That's a really important point, and there's some really harmful assumptions in that term. So I apologize for that. And I think really what's important to emphasize is that without universal pharmacare or dental or eye coverage, we're relying on employers, and there's a lot of inequities then in terms of who has good benefits through their jobs. And so low wage workers are much less likely to have those benefits. Racialized, immigrant, young, part-time workers are all less likely to have those benefits. And that can mean that they then can't afford medication or dental care or really important parts of their healthcare. So thanks for that comment. Okay. Let me see. From Alice, what do you see as the biggest challenge to policies addressing precarious work? Can I hand that to you, Carolina?
Sure. I think this kind of circles back to what Rebecca was discussing in terms of some of the dominant narratives, which unfortunately, both in sort of the labor world as well as society at large, there's this underlying belief of scarcity, of decent work is too expensive, of raising the minimum wage is too expensive, it's going to cost businesses. And so I think that that dominant narrative is really difficult to change. And I will say that that is also an intentional narrative that beliefs, for example, in like capitalism are really sort of rooted in the way in which policies are structured. And so, as we have seen with paid sick days that have now been implemented in British Columbia, where, for example, Ontario might have said small businesses can't afford that, the sky hasn't fallen down here in British Columbia. And in fact, that number has been doubled for federally regulated workers. And so a lot of this is sort of combating that belief that, business can't afford this, or that sort of really going back to that economic argument. And yeah, to be honest, I don't really think that that's fair for workers. So I think that's probably one of the most difficult things, but being able to say no, recognizing these as, again, these dominant narratives rooted in scarcity and being able to combat them, even with some evidence. I think to that point, there is some really good sort of myth busting that some of these organizing groups have done. So I definitely recommend checking out some of their websites or even getting in touch with them if you're running into some of those narratives that we can't afford paid sick days, or we can't afford that workers have higher minimum wages and so forth. Yeah, does that sort of answer it, Rebecca? Anything to add there?
That's great.
Yeah.
Thank you. Okay. What else? So we have, can decent work become an aggregate indicator? Statistics Canada could start publishing per province, from Karine. That's a great suggestion. There's definitely an important role for data and research. StatsCan has a big role there, as well as public health organizations. Assessing and reporting is an important role. And so with the practice brief that will be coming out probably in March, we do highlight that role of assessing and reporting about both precarious employment and hazardous working conditions, as well as aspects of decent work, like paid sick days. And Peel, for example, did report on paid sick days during the pandemic. So great, absolutely, to that suggestion. I also, from Shana, are you aware of any of this work being done in Nova Scotia? And I will say, yes, off the top of my head, there is a Justice for Workers Nova Scotia campaign, which are calling for 10 paid sick days, $20 an hour, minimum wage, equal pay and benefits for equal work. There's a number of different changes they're calling for. There's also the Halifax Workers Action Center, which helps workers fight for their rights. So, and I also see someone has shared in the group, and it's now in the chat, is from Dorothy, a group of Nova Scotia, a group working with migrant workers. So thank you so much for sharing that. Okay, and let me see, we probably have time for 2 more questions. So from Dorothy, why is it so difficult to include occupational health in public health when it's really part of the latter? That's a great question. And I think in general, we see that decent work and work as as a determinant of health is often overlooked. And so that's part of why we're doing this work. And in the practice brief, we will outline a number of roles we think public health can play and strengthen. Yeah, I think during the pandemic, there was a lot of catching up that public health had to do in regards to the risks workers were facing in workplaces. And many times those risks weren't addressed, and workers were really hard hit by COVID. Carolina, do you have any thoughts about that question?
Can you repeat the question again? Why is it so hard that public health?
It's a difficult one. So why is it so difficult?
Yeah, it's a tough question.
Occupational health in public health.
Yeah, that's a really difficult question, and I'm not sure that I have a much better answer than what Rebecca has shared. Other than just to add that I think that there's lots of opportunity for public health to get involved, both with regards to the working conditions themselves. So that's more so occupational health and safety, as well as employment conditions. So these larger policies. So I think that the larger policies can come and really be a protective factor for some of these working conditions, occupational health and safety. So I think that the interplay between the two is really important. And I think public health has an important role to strengthen their action in both avenues, both when it comes to, healthy public policy with respect to employment standards and even occupational health and safety standards, as well as the actual hazardous working conditions at the work site, because you can't address one without addressing the other. And I think that that's really the crux of, at least for me, of what Rebecca was saying earlier with respect to those two key concepts.
Thanks. Okay, I think we have time for maybe one more question. So from Sarah, what are the levers to engage with policy people at the federal level? You mentioned immigration policy. What other ministries are involved? Okay, this is a big question. Yeah, so definitely immigration. There's a huge intersection there with decent work for migrant workers, and there's a lot of changes that could be made federally. Caroline already mentioned the Canada Labor Code, which regulates federally regulated workers, like people working in air travel or trains. And so those were expanded and strengthened recently. So that's a really important example of a federal role. And we already had that great suggestion earlier about the role that Statistics Canada can play in terms of reporting and gathering good data about decent work. Any other thoughts there, Carolina?
Yeah, Ministry of Labor.
Mm-hmm.
As well as I mentioned that decent work is one of the sustainable development goals, the 2030 sustainable development goals. It was part of goal 8. It's on the Canada government website. So I don't know, that could be potentially another avenue as well. And I know that Dr. Teresa Tam has talked about this in several of her reports. And I think continuing to make the links with different sort of, quote unquote, wicked problems that are happening. So for example, with climate change, I think that's a really important link to make, that in order for communities to be climate resilient, they need decent work. And we need to help and strengthen community organizing to empower workers as well as part of that approach. So I think there's some avenues there.
Great. Okay, we are running out of time. Thank you so much for all the questions. There was one final one from Deborah. What do you mean by public health action? We mentioned it a few times. We absolutely did. So that is any type of way that public health organizations and staff are taking action to advance decent work. We're going to be exploring that in the practice brief, which will be published in March. So really keep an eye for that. And Caroline did share that great example of sick day organizing for paid sick days, and decent public health folks did take action and contribute to that organizing. So Carolina, I'll let you take away the rest of the presentation.
Yeah, sounds good. So we have a couple more minutes. I just want to ask one final Slido question. What is one thing that you learned today that made an impact on you? So go ahead and scan that QR code. I think it'll also be in the chat. Got 3 participants typing. Are there a couple of more folks that want to join and write some comments there? In every province, the rental wage exceeds the provincial minimum wage. Yes, alarming. Reminder that all these policies are deliberate and modifiable. The impact of harmful dominant narratives. Yes, power of collective efforts regarding paid sick days. Resources to bring to partners and colleagues for sharing and consideration. Understanding better the scope of work happening on the issue. Amazing. Policies are intentional. How these conditions are modifiable. That's really awesome. Connections made by public health leaders. Highlight those. system was not set up for folks to succeed. Yes, it was set up for corporations to succeed. Importance of how work conditions impact health. That's amazing. Public health can partner with worker-led groups. Yes, decent work is achievable. It sure is. Amazing. Okay, just for the sake of time, I'm going to move this along, but thank you so much to everyone who is still typing answers. Feel free to keep typing the answers. And so thank you so much for coming to today's presentation. We'd love to connect with you one-on-one. If you want to chat further about decent work, please reach out to us. Our emails are on the slides there. We'll be hosting another conversation to discuss the practice brief, so keep an eye out for that. And I'd also like to point you to our podcast if you haven't heard of it. The NCCDH has produced a podcast. Season 1 is complete and we're working on season 2. Podcast is called Mind the Disruption. It's about people who are disrupting, who are pushing for better health for all, including for decent work. And so we feature some really amazing decent work stories in season 1. So please check those out. We'll put the link there to our site. We're also working on season 2, which will be put out starting in February. So really close around the corner. I believe the trailer is out, if not almost out. So please follow and like us on your favorite podcasting app, as well as sign up for the Mind the Disruption mailing list through our website. And just one last thing to close us off today, if you can spare a few minutes of your time to complete the evaluation. Pema will also put the link in the chat, and it'll also pop up on your screen as the webinar closes. Your feedback is really welcome so that we can learn how to better support you on this topic or in webinars more broadly. So yeah, thank you so much again for coming. Really appreciate you folks.